Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be going over NCLEX topics. I hope you guys are all enjoying your summer. I'm enjoying mine, but I couldn't stay away. So um, I put together, I think there are about 16 slides of important concepts and topics you need to know for NCLEX. Be sure to check out my website. Got so many resources there for you, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across your social media platforms such as TikTok, Instagram, Facebook, and YouTube. I'm getting a lot of mail about my tutoring services. I'm off for the summer. I do not start tutoring again until September, and my calendar to make an appointment will open up in August. So if you're interested in getting private tutoring sessions with me, go to my website and you'll see my calendars open in August. I book very, very, very quickly. So I'm telling you now, if you find an open slot, even if it's not the one you wanted exactly, just take it and then keep checking to see if maybe you can reschedule. Maybe someone drops an appointment and you could get something else because I book very quickly. Okay. It's only one of me and a million of you guys. Um, was there anything else? Very soon, something else I've been getting questions about my NCLEX cheat sheet. Yes, it's coming out very soon. It should be out and available to the public by fall. And my Nexus Nursing uh oh my gosh, I have vacation brain. I'm sorry, guys. My test bank. My NCLEX Nexus Nursing Test Bank is going to be a test bank for LPN, LVN students, RN students, and nurse practitioner students. That also should be available in the fall, but more, when I say the fall, I'm more September fall, not August fall, but it's coming out soon as well. So again, guys, for updates, just check my website, nexusnursinginstitute.com. Thank you so much for watching. And oh, I feel like there's something else I want to say to you guys. It's been so long since I did a video. I feel like I'm missing something. Test bank, cheat sheet, tutoring. Maybe that is it. All right, guys. So I guess that's it. If you have any questions about this Kahoot, because it's going to be live and it's going to be mostly from students on TikTok. However, I do plan on doing one for YouTube as well. But if there's a question you weren't able to get on, please, in the comment section, go ahead and ask your question, and I'll try my best to be able to respond. Okay? Thank you for watching. NCLEX topics. First question. It's one day after an open reduction internal fixation. A patient reports a tingling sensation in his foot. Pedal pulse diminished. What is the priority concern? Would it be deep vein thrombosis? Would it be circulatory compromise? Would it be infection? Or would it be pulmonary embolism? So it's one day post ORIF. The patient's reporting tingling sensation in his foot. You check his pedal pulses and it's diminished. You check the pedal pulse and it's diminished. What is the priority concern? DVT, circulatory compromise, infection, or pulmonary embolism? If you are not in the Kahoot, you can still participate. You can participate in the live. Okay, let's talk about this. So most of you guys got it right. Circulatory compromise, very good. But on the live, most of you guys are saying DVT. I know you guys did not bring me out of my vacation for this. Not DVT. Okay, couple clues here, guys. The minute you see a patient has a fracture or an ORIF, which is a procedure for a fracture, immediately a couple things should be going through your mind when you're thinking fracture. You should be thinking hemorrhage. You should be thinking pain. You should be thinking DVT, possibly. Yeah, absolutely. You should be thinking pulmonary embolism, and you should be thinking compartment syndrome, right? So the fact that I see ORIF, I'm already thinking about these five things. Let's keep going. Tingling sensation, that's paresthesias. What does that go with? Compartment syndrome. Pedal pulse diminished. Compartment syndrome. How'd you guys get DVT? If it was DVT, patient would have had pain, would have had redness, would have had swelling in that extremity. That's not what we're looking at, right? We're going to be concerned about circulatory compromise. Everyone on the same page? Okay, let's keep going. Oh, no, no, let me talk about the other options first. Um, Infection, you know those signs of symptoms of infection, um, redness, inflammation, mucopurulent drainage, probably see some labs, WBCs increased, right? Foul odor coming from wound. And pulmonary embolism, that's when usually from a DVT, the patient has a clot, and then that clot, or maybe foreign body such as air or piece of tissue, it's now floating in the blood and it lodges in the pulmonary artery. Now the patient's got a pulmonary embolism. That patient would present with things such as shortness of breath, cough, hemoptysis. Um, you see these four guys for NCLEX, you have to know all four. You have to know the signs and symptoms of all four. You have to be able to recognize them, and you have to be able to recognize your nursing interventions for all four, okay? During a head to toe assessment of a patient post head trauma, which finding warrants immediate intervention? Would it be clear fluid leaking from the nose? Would it be slight drowsiness? Would it be visible bruising on the forehead? Or would it be no abnormalities? Which patient are you running to first? You're doing a head to toe assessment on a patient after head trauma. Which one requires the most immediate intervention? Clear fluid leaking from the nose, slight drowsiness, visible bruising on the forehead, or no abnormalities. Very good. Clear fluid leaking from the nose. And I'm seeing on the live, everyone's saying CSF. That's right. You're suspecting cerebral spinal fluid, right? Now, what would you test for on that fluid as a preliminary test to see if this is in fact a cerebral spinal fluid? What would you be looking for in that fluid? Can you guys tell me? Glucose. Very good. Very good. That's right. If you see that halo ring, you know it's glucose. You know it's cerebral spinal fluid. When preparing a client for discharge after cystectomy and urinary diversion, what is the most important instruction? Would it be keep the surgical site dry for 2 days? Would it be avoid strenuous activity for a week? Would it be limit oral fluid intake for 24 hours? Or would it be report any signs of cloudy urine? What would be important discharge instructions? Very good. Report any signs of cloudy urine. So, with a cystectomy and a urinary diversion, most likely this patient either had bladder cancer or some type of trauma to the area they have this. Um, this invasive procedure, any invasive procedure, guys, whenever you're reading a test question and they mention an invasive procedure, immediately you need to be concerned about these three things: hemorrhage, DVT, pulmonary embolism, and infection. Turn on reactions to express yourself. What is that? Anyway, those are the three you're always going to be concerned about whenever there's mention of an invasive procedure, right? So, with that being said, when we're looking at our options, the only one that would address any of those three would be report any signs of cloudy output, which would point to what? Infection. How often do you do these Kahoot? I'm on vacation. I'm not even supposed to be here. Not very. 12 hours after splenectomy, a patient's urine output is 25 milliliters per hour for 2 hours. What's the most probable cause? Would it be post-op dehydration, urinary tract infection, tubular necrosis from hypoperfusion, or renal calculi obstruction? 12 hours after splenectomy, a patient's urine output is 25 mLs for 2 hours. What's the most probable cause? Okay, you guys are all over the place on the live. Wow. 51 of you guys said post-op dehydration. Okay. Let me repeat myself. After any patient has had surgery, they've had an invasive procedure, your top three concerns, please write this down, is going to be infection, hemorrhage, or DVT/PE. Post-op dehydration does not fall into one of those categories. So we're going to get rid of that. We're going to get rid of that right away, right? UTI, that's an infection. Tubular necrosis from hypoperfusion. Yep, that would happen from bleeding. And no to renal calculi because that has nothing to do with infection, hemorrhage, or DVT pulmonary embolism. So you should have narrowed it down to either a UTI or tubular necrosis from hypoperfusion. You should have narrowed it down to those two. Now, I'm teaching you how to think, guys. Look at the question. So it's 12 hours after an invasive procedure, spleen's been removed. The urine output is supposed to be at least 30 mLs per hour. This patient's 25 for the past 2 hours. What do you think's happening? Remember what your options are: hemorrhage, DVT/PE, or infection. What do you think is happening here? Tubular necrosis from what? Hypoperfusion. You're lucky I wrote hypoperfusion. I should have just wrote tubular necrosis because that's how NCLEX does you, right? They're not that nice. Your brain is supposed to say, whoa, this patient just had an invasive procedure. They're bleeding out. And the body tries to survive no matter what. So when you're bleeding out, you're losing oxygen, vitamins, mineral, nutrients, all that good stuff that's supposed to go to your tissues and your body's going to try to survive. Guess what? The first organ is going to shut down. It's going to be your kidneys. It's trying to hold on to the little bit of fluids you have left, and it's going to divert those fluids to where? Your vital organs, such as your brain, your heart, your liver, your lungs. That's what's happening here, guys. Tubular necrosis from hypoperfusion. This patient's bleeding out. Are you guys with me? You can't see? Professor D, fix the phone. We can't see the first two ones. Okay. Hold on. Give me a second. Is this better? Is that better? No? How about now? All right. Now you want me to zoom out? Okay. It's too close. Push back. How about now? Perfect. Okay, good. So demanding. Okay, who would you put in a room with your burn patient? A patient with Cushing syndrome, a patient with cellulitis of the left leg, a patient with a peritonsillar abscess, or a patient with pelvic inflammatory disease. You're caring for a burn patient, you have a new admission. Which one would you put in the room with your burn patient? Would it be Cushing syndrome, cellulitis, peritonsillar abscess, or PID? That's okay, you're going to learn it. Very good. Cushing's. Why? When it comes to burns, there are a couple things you need to know about burns. The minute you see the test question mentions burns in the forefront of your mind, here's what you need to be thinking about. One, pain. If you've been following me, you know that I say pain never killed anyone. Pain is never a priority except for five situations. What are those situations? Sickle cell crisis, cancer, stones, MI, and what? Burns, right? So the minute you see burns, you should be thinking about pains. That's going to be a priority. What else should you be thinking about? Dehydration. This patient is going to have to be hydrated because what happens when there's a severe burn, all of the protein that's in the blood seeps out of the vessels, goes to the tissues. And guess what happens? Once there's no protein, that albumin's gone, all of that fluid, whoop, it's out. So this patient will look all swollen, but they're dehydrated and their organs can start to shut down. So the second thing we're concerned about is dehydration. And the third thing, what are we concerned about? Um, oh, infection. So pain, dehydration, and infection. Remember, your first barrier from pathogens, from viruses, from any type of infection is your skin. Now your skin's been compromised, right? So any patient that's a burn patient, they are at risk for infection. Lots of burns patients, they don't even die from the burn. They end up dying from secondary infection caused from the burn. So you cannot put anyone with an infection in the room with the burn patient. Cellulitis, infection. Peritonsillar abscess, infection. PID, infection. The only one that's not infection is Cushing's. What is Cushing's? Patient got way too much cortisol. You know Cushing's, they got the moon phase, the buffalo hump, the purple striae, the big abdominal girth with the skinny legs and arms, right? But no infection. That's who you're going to put in the room with the burn patient. The nurse cares for the patient diagnosed with HIV. Which goal is most important? What is going to be the priority? Prevent Kaposi sarcoma, prevent depression, prevent infection, prevent social isolation. What is the priority? Very good. Prevent infection. This patient is immunocompromised. Whenever you get a test question and they mention a diagnosis, and that diagnosis, whether it's HIV, whether it's I can't even think, guys. I'm sorry. I so have vacation brain, but any other disorder where a patient, where it's a cancer patient getting chemo or radiation, whatever disorder will cause a patient to be immunocompromised, the most important goal is preventing them from getting an infection because one tiny little infection, the common cold, will be enough to take them out. Now, on the live, I saw a lot of you guys choose green. You guys chose prevent social isolation. So let me say something to you. Whenever you get a question and it asks you about your priority, I'm telling you right now, the patient's physiological status is always going to take precedence over social, not socialism. What am I trying to say? Their physical, their physical integrity. That's always going to be number one. So you think of Maslow's hierarchy of needs, it's a pyramid, right? Everything on the bottom of the pyramid is what you care about the most. Things that keep your patient alive, airway, breathing, circulation, fluid and electrolytes, right? Um, all that good stuff. On top of the pyramid, the last thing we're going to be concerned about is going to be socialization. When it comes to socialization, when it comes to emotions, when it comes to thoughts, and when it comes to teaching, all of that stuff, it's not a concern. The only exception to that rule is thoughts like if the patient's having a they want to themselves. I don't want to say it on TikTok so they don't end my live. But other than those type of thoughts, it's not a priority. Okay. Physiological integrity always comes first. All right. Your patient with pneumonia gets postural drainage every day. Which statement indicates effective treatment? Would it be my tummy ache is better? I'm coughing up more sputum. My cough is better. I don't feel so hot anymore. Which statement would indicate to you that the patient's treatment is working? Your patient has pneumonia and they're getting postural drainage every day. How do you know they're getting better? Very good. I'm coughing up more sputum. You see this question? This question's not about the pneumonia. This question's about the postural drainage. How do we know that? Which statement indicates effective treatment? What's the treatment? Postural drainage. And this is another way NCLEX will trick you because you see this question, you're thinking that question is about pneumonia, but no, the question is about the treatment, which is what? Postural drainage. What does postural drainage do? It removes excess secretions. It helps loosen up those secretions to remove them. So how do you know it's working when they say they're actually coughing up more sputum? What is the sputum? The excess secretion. Duh. Do not fall for it. These are the little tricks that NCLEX uses on you guys, and I want you to be able to recognize them for what it is, okay? In which situation would your diabetic patient's insulin needs decrease? Infection, emotional lability, surgery, or exercise? In which situation would your diabetic patient's insulin needs go down? Very good exercise. I saw a lot of you on the live. You said yellow. You went with surgery. Let me tell you something. Any stress on the body will cause the blood sugar to go up, which means the patient will need more insulin. Infection, that's a stress on the body, blood sugar up. Emotional lability, that's a stress on the body, blood sugar up. Surgery, that is definitely a stress on the body, blood sugar go up. Exercise. You're going to teach your patient to make sure they check their blood sugar before and after because after exercise, their blood sugar may drop. What you faster? Hypoglycemia or hyperglycemia? Hypoglycemia. So it's very important to teach that patient to check their blood sugar. We don't want it going lower than what? 70. Okay. All right. Your patient has burns to the entirety of both arms. What's the estimate of injury? Is it 18%, 29%, 36%, or 9%? Oh, very good. You guys know your rule of nines. I see you. You do burn calculations next semester. Okay, you're ready. They didn't teach you burn percentages. You were texting. 18%. Guys, you have to know your rule of nines, okay? When it comes to burns, make sure you know your rule of nines, okay? So it says the entirety of both arms. So one arm, guys, the front is going to be 4.5, the back 4.5 of one arm. That gives you 9, right? But it's both arms. So you do 9 times 2, which gives you 18. Make sure you review the rule of nines and you review Parkland formula. I don't know what you're going to get. You might not get any, you might get both. Make sure you know both of them, okay? Parkland formula and rule of nines. Which is the best question to ask your patient when you see these lab values? So the pH is 7.5, the CO2 is 40, and the bicarb is 30. What is the best question to ask your patient? Do you smoke? Do you have a history of emphysema? How long have you been vomiting? Do you take insulin for your diabetes? What's the best question to ask? I'm going to teach you guys another trick as well. Very good. How long have you been vomiting? But that came very close to, do you have a history of emphysema? All right, so let's talk about this. Before I even get into the lab values, look at your options. Do you notice 3 of the 4 are closed-ended questions? They're yes or no, they're questions that require yes or no answers. I'm telling you this now. 99% of the time in nursing, the only time you're going to ask closed-ended questions is if it comes to abuse or the you want to see if the person wants to off themselves. What's the third one? Oh, emergency assessment. So if the patient's being rushed to the OR and you need to know right away, have you had alcohol within the past 24 to 48 hours? Do you smoke? Things that you need to know before you go into surgery with that patient, yes or no. But other than that, you're going to ask open-ended questions. So even if you had no idea what this question was asking you, just looking at the options as a student, you should say to yourself, well, I don't know what the answer is, but let me go with the open-ended question. Now, with that being said, let's take a look at this question. pH 7.5. Well, we know the normal pH is supposed to be 7.35 to 7.45. Anything higher than 7.45, it's alkalosis, and anything less than 7.35 is acidosis. Well, 7.5 is higher than 7.45, so we know for sure this patient is in alkalosis. We know that for sure. We just don't know if it's respiratory or if it's metabolic. So let's look at what the lungs and what the kidneys are doing. When we look at the lungs, the CO2 is 40. Well, regular, normal is 35 to 45. So the CO2 is straight. The lungs are fine. It's within normal parameters. What about bicarb? Bicarb's supposed to be 22 to 26. Uh-oh. This patient's bicarb is way more than 26. It's what? 30. So we know the patient's in metabolic alkalosis. We know this. All right. Patients in metabolic alkalosis. That's why you're asking them, how long have you been vomiting? Because every single time you vomit, you're getting rid of stuff that's in your stomach. What's in your stomach besides food? Hydrochloric acid. That's what breaks down the food. So when you're vomiting, you're getting rid of all your acidity, which throws you into an alkalinic state. Metabolic alkalosis. Boom. Okay. All right. Wait, before I move on. So let me ask you guys, this patient that's in metabolic alkalosis, what do you think the lungs would do if the lungs wanted to compensate, if the lungs wanted to help? What do you think would happen to that patient's respirations? Would it increase or would it decrease? Okay, you guys are all over the place. Okay, so I'm going to help you think this through. If your patient's in metabolic alkalosis, they've got way too much bicarb, and the only guy that can help are the lungs. The lungs can do one of two things. speed up respirations or slow down respirations. If the patient's in alkalosis, way too much bicarb, not enough acidity, the respirations are going to slow down. Why? So you can hold on to CO2. Why? CO2 is acidic. That's how your body's going to try to get you back to homeostasis. Your respirations would slow down if the lungs wanted to help out. Okay? What would you expect your OCD patient to demonstrate? Would it be marked emotional maturity? Would it be elaborate delusions and hallucinations? Would it be rapidly alternating moods? Or would it be doubts, fears, and indecisiveness? Your patient's OCD. The code is 376157. 376157. Very good. Doubts, fears, and indecisiveness. So, OCD is a type of anxiety disorder. And so, many of the patients that have OCD, um, they get their control from whatever it is that they're hyper focused on. It gives them that sense of control. So and when you're treating this patient with OCD, when you're caring for them at the very beginning, I'm telling you this, guys, for testing purposes, listen to what I'm saying to you. If they tell you your patient has OCD, it depends where in the treatment they are. If this patient's just been admitted for OCD, I'm telling you, this is the answer. You're going to allow them as much time that they need to perform their rituals. If they've just been admitted, that's what you're going to do. Why? They just been admitted. It's they're going to be very anxious. So the OCD is going to be in overdrive, right? But every day that goes by, as this patient's getting treatment, as they're on medications, the time that you allow them to perform their rituals will become less and less and less. Why? They're learning how to cope with the real world. So little by little, you decrease the amount of time that they have to do their rituals. Even if you have to get the patient up a little bit earlier than normal, why? Because you don't want them to miss out on anything during the day. Okay? That's very important. What drug cannot be given intravenously? Dextrose, potassium chloride, furosemide, or calcium gluconate? Which one cannot be given intravenously? Okay, everyone's getting this one right. That's right. Potassium chloride, unless you're the executioner in the prison, that person's on death row, you are not pushing potassium chloride. Um, the body has a very, very narrow therapeutic range for potassium, 3.5 to 5. That is it. Anything outside of that range, that patient will have cardiac arrhythmias. Their heart may even stop. Their heart will stop, actually. Okay? That's right. Lethal injections. That's what we get. Not we. That's what the executioner gives. Your patient with hemophilia wants to play sports. Which sport would you suggest? Soccer, gymnastics, swimming, snowboarding. Which sport would you suggest? That's right, swimming, no contact sports. They're at risk for bleeding. Something else you have to know about the patient that's a hemophiliac, where do they tend to bleed the most? It's going to be in the joints. You're going to teach them about safety and being careful, not bumping themselves. Yep, swimming, you better go bowling or play golf or something. No contact sports, no sports where you can injure yourself. What does a cyclovir treat? Herpes simplex, contact dermatitis, atopic dermatitis, psoriasis. You see this drug? This drug has been seen on NCLEX for PN, NCLEX for RN, and the nurse practitioner certification exam for both ANCC and AANP. You cannot run away from this drug. Make sure you know it. Make sure you know the indication, adverse effects, nursing interventions, patient teaching. Very good, herpes simplex. Very good. What is the cause of most burns in the elderly population? Frayed wires, pots and pans on the stove, lighted cigarette, bathtub of hot water. If you're taking your boards in Florida, New York, Texas, California, you better know this answer. Oh, in New Jersey. Okay, pots and pans on a stove. 72 of you guys went with a bathtub of hot water. No. The most burns from in the elderly population, they'll burn themselves from either trying to cook or, they were cooking or something was hot on the stove. And that's where most of the burns come from. No. Ohio, from what I understand, I haven't seen it. I'm just reporting back from what students told me. For Ohio, students have seen a lot of alcohol withdrawal, like a lot of like alcohol and substance questions. But yeah, not bathtub of hot water. It's pots and pans on the stove. Okay, you're caring for a patient that almost drowned at the beach. For which complication would you be most alert? Would it be hyperkalemia, hypomagnesemia, hypocalcemia, or hypernatremia? Or really, guys, you're going to start asking me for each state? You've got a near drowning patient from the beach. What complication are you going to be most alert for? Very good. Hypernatremia, the salt water. Very good. Make sure, listen, I almost forgot. So something else I want to say to you guys. There are a lot of people on my live, and I'm so happy that I see a lot of students who are about to start the nursing program. Don't be nervous. You're going to do great. But one piece of advice I would give you, don't wait until they teach it to you in the program. Learn it now. Learn vital signs and lab values. Memorize them. Memorize the norm and what it means to be outside of the norms. I cannot tell you how many questions that you may not know, but you'll get right simply because you understand the significance of when something is high versus when something is low. So if you're about to go into the nursing program and you're really nervous, you're really scared, you want to start learning, learn those too. Learn vital signs, temperature, respirations, blood pressure, heart rate. Learn the parameters and learn what it means when they're high versus when they're low, and learn lab values, RBC, WBC, hemoglobin, platelets. It's going to make your life so much easier down the road. All right, guys, let's see how you did.